All right, gang, it's 4:30 on the drive home for Thursday. Wayne, Tanya, and Brian alongside, and we are very pleased to bring in our esteemed guests, Dr. Ryan Jennings, the Chief Medical Officer at HSHS St. Anthony's Memorial Hospital. And Doc, good afternoon. How are you?
Well, I'm well and complimented and flattered by that. So I don't know if I'm an esteemed guest.
Well, I'm not overselling it. I mean,
yeah, it's accurate.
So, Doc, we'll just start into things right away. Obviously, not a very good day for numbers around the state of Illinois, with today the largest one-day death total of 125, along with 1,140 new cases of COVID-19 coronavirus in the last 24 hours.
You're correct, and I think that as you look at that, you have to keep in mind that one of the problems with this particular disease is that the mortalities and the deaths happen oftentimes much later than when the disease becomes apparent. And so I'm not surprised that we have an uptick in the number of mortalities, but it to me just continues to speak to making sure that we are distancing, that we are reducing the spread of the disease, because at the end of the day, a certain number of people will always get this and always suffer the consequences of it. But if we can reduce the number of people on the front end, that's the right move. So it's unfortunate, but I think it's just a reflection of the reality of the disease.
Gotcha. One of the things that has been asked probably more than anything, Doc, and I know that you're not the Department of Public Health, but it is an interesting question. In a county of roughly 50,000 people, why have we performed less than 60 tests?
Well, it is a great question. And, as we've talked over the last several weeks, the need for the test means that at some point I can do something with the results of the test. And so me testing, and I'm not meaning me by me, but in the big picture, testing folks that are asymptomatic or that don't work in certain professions doesn't change the fact that it's out there in the community. So testing is only useful if it's going to change what I'm going to do as far as hospitalization or being able to give you information about what your outcome might be in a situation where disease does not have a treatment. Testing is not as valuable. And so long story short is I'm not sure that there's a reason to do much testing in a county of our size or any other size for that matter if you're not hospitalizing people and they're not in an environment where they would expose others to risk, like nursing homes, et cetera.
So basically you're saying that if you have the symptoms, the best thing to do is just shelter in place for the 2 weeks, keep yourself isolated and not expose yourself.
Correct. If you're not so sick that you need hospitalization, then the right thing to do is to do what has been out there for everybody to be doing, which is unfortunately, sheltering in place and not exposing others to you, because you might be negative today and positive tomorrow. And if you were out in the community, a negative test won't reduce the risk.
That's true.
Very interesting.
And we have seen, as in the case, especially in Fayette County and across the country, another long-term care facility with multiple people infected. Obviously, someone brought it in from outside that didn't heed the warnings, right?
Well, I think those congregated living environments are why the focus on testing for them is different. Exactly because of that, because if you're in that type of environment, you don't always have as much control over your exposure. And so our threshold for testing in those environments is different than the average person out in the public. But that's because I can ask you to go home and shelter in place. If you are living in an environment where you might spread it to another 20, 30, 40, 50 people, my reasons for testing you become lower because I might want to know that. So I do think the Illinois Department of Public Health guidelines around this have really been spot on in relation to how do you manage this type of situation, and especially in a setting of limited testing and the absence of treatment. So the right thing to do is to shelter in place.
All right. Hey, Doc, if you don't mind, can I ask you one of the questions off of Facebook this afternoon?
Please. You can
All right.
ask me anything.
Amanda asks, what's your take on material masks in public places? And to that end, do you think people should be wearing masks?
So when the CDC changed their position around the idea of masking in public, it was based on the idea of controlling the source, meaning if I cough or sneeze, that I won't accidentally spread it when I'm not necessarily sick. So I'm an asymptomatic person. I don't have symptoms, but if I go out in the public, if I cough, sneeze, I could spread it. And if I put on a mask when I cough or sneeze, that spray, for lack of that kind of sounds terrible, but you know what I mean, is much smaller. And so that's where this originated from. So yes, I agree with the idea that that we should be doing what we can all do to, first of all, not be out, but if you are going to be out, do the things that you can do to reduce the spread by masking, so that if you cough, sneeze, etc., you don't accidentally expose someone to something when you're not even sick. That's the hard thing, is that there's a fair known entity around carrying the disease when you don't necessarily be sick. And so I think that's what makes it hard for folks to appreciate why it's important to mask. And that's why it's important to mask. It's because you may be carrying the virus and not know it.
Very interesting. Yeah.
I think some of the interviews that they had with, the people that tested positive for COVID-19, some of those people had mentioned that their symptoms weren't very, bad at all. It just, I don't know if they were surprised that they tested positive for it. I think you're absolutely right on that.
Right. So you might have, and some of the subtle things that have been out there around losing your sense of smell or taste and those types of things, I just don't know, will be eventually borne out as a great indicator. But, what we're lacking right now is a lot of research, because we don't know. We actually are pretty fortunate to live in a country that uses a lot of really good evidence. And in this circumstance, because it's been so quick, we've not always been able to be as diligent around that. And so people are having to make conclusions that may not bear out, or they might. And so best advice is the CDC's direction around masking, and everybody just continue to do a great job that we have been doing around sheltering in place.
Well, Doc, I know this isn't exactly a new question, but we'll still kind of see what your take on this is. With Effingham having so many transportation options in the area, we've heard of cases, I think it was one up in Sarah Bush maybe, where they had a traveler that came in off the interstate and was diagnosed with the virus. And I believe, I don't remember if I have the facts exactly correct, but I believe they were allowed to continue on to their destination after some type of reassurance was given. And I don't want to get into all the details of, we had cases or issues with the tour bus item here in town and things like that. That's a whole nother topic. But just in terms of travelers in general, what do you think, if someone is diagnosed that's coming through this area, what's the next step? Is it just something where they really need to stay here, or is it like I'm imagining where, if they're symptomatic or asymptomatic, whatever, if they're able to continue on to their destination, that's the best course of action? What is the decision process or brief issues with travelers coming through this area?
Oh, really good question, especially with where we live. I think that depends upon your ability to continue to socially distance.
Mm-hmm.
So if you're and I'm just picking an example, but if you're an over-the-road truck driver,
Right.
In fact, you're kind of socially distanced by the nature of your work.
Mm-hmm.
If you're a tour bus driver, that answer is different.
Yeah.
And so I think it's up to all of us to acknowledge that whether or not we're able to appropriately socially distance, and if we are, then carrying on at some level makes sense. But if you're not, then you should be figuring out a way to socially distance. So there's not a right or wrong there. I don't think. I think it's a decision making around whether or not you're able to follow the guidelines, and if you are, then going on to your destination makes sense. If you're not, then we need to come up with a different way to manage the circumstance.
All right. One other question that someone asked us on Facebook, Doc, they had talked about people going back to work that are sick and maybe haven't been tested. I know a lot of people, this is the whole going back to work thing and getting back to the way things were is obviously a really, really, really hot topic right now.
Yes.
St. Louis County today, over in St. Louis, extended their stay-at-home order to the middle of May and actually said indefinitely, but earliest the middle of May. I mean, what is it too early now? I mean, I know there's not a lot of cases around Effingham County. We've had one death. The person was technically in Chicago but did live here. Is it too early to start talking about getting back to work, or do we need to wait this out longer?
Boy, you are trying to ask me really hard questions.
Well, we're trying to get the most for our money here.
I get it. I think I do think that we have to have a conversation about getting back to work. At the same time, we're having a conversation about businesses that are facing the reality of a very difficult time financially, and whether that's the hospital or that's any business in the community where they're trying to help their employees to find the resources that it takes to make them whole. And right now, for many businesses, that is going to be something that where we're directing them to the unemployment situation so that they're going to be able to provide for their family and do those things. Should we come back from an epidemiological standpoint, I don't think we're there yet. And again, this is me speaking, not no guidance from any expert. I think that you have to go ahead and let this play out in some of the major cities, and then once it completes the cycle within the major cities, then the rest of the world can circle back around about, is it time to reopen business? Right now, we haven't seen it finish up yet in the major cities, and so the answer of today is shelter in place and do all those things that we're asking folks to do. And I have to laugh every time a memo comes out. It's as of 3:05 on Thursday. and so it might be 4:35 now, but either way, I mean that's as of what I know right now. But subject to change at some point. Yes, life has to reopen.
Mm-hmm. Well, and we are all looking forward to that time. We know for that for sure. Doc, it's always good to talk to you, and your information for listeners is fantastic, and we wish we could spend more time with you. We really, really do. You do it so well.
Well, I appreciate that, and I, as always, appreciate you guys giving me the time. And the questions have gotten harder, but that's because we're getting further into a very difficult situation, and so now the nuances become much more relevant. And so I think that as folks come up with questions, I do want to know those, and I want to thoughtfully provide as much information as I can and the hospital can, and et cetera. So please keep bringing your questions.
Well, we appreciate that so much. That open forum is really, really, really good this time, during this time, and you really handle things really well. So, Doctor, thanks so much. Look forward to our next conversation.
Thank you. Have a good week.
Thanks.
You too.
You too.
Yeah, thanks a lot.
Dr. Ryan Jennings, the Chief Medical Officer at St. Anthony's Memorial Hospital here in Effingham. Always great to talk to him, especially during times like this. So,
good words, indeed. Good words, indeed. Good words.